Okay, in this short video, just going to talk to you about using a lacrosse ball to release tissues in and around the quad area, with specifically for things like knee pain and hip pain. Okay, so I like to use the lacrosse ball for targeted use. We're going to start off with hitting the medialis, this muscle here, teardrop muscle just above the knee on the inside. What I like to do is start by just gently rolling through. Now, we're not trying to iron out any tissues here when we're doing this. Just think of it of giving the brain a signal, and then the signal is going to come from the brain back down to the muscle to cause effect. So we're not trying to iron this stuff out here. Okay, so all we're going to do is just start to spend a bit of time just gently releasing through the area. Hunt around for any tight spots, work right down towards the knee, and then all you're going to do is begin by lifting the foot off the floor and then contract and relax all through the area. Move yourself around in that medialis area. A good place to get is right towards the top of that medialis tendon as well. And work through there. You might spend about 30 seconds to a minute doing that. Next area is we're going to be working on getting the rec fem, which can be a real problem area for pulling up on the patella tendon if it's tight and causing inflammation on the knee. So what we're going to do here is we're going to start with the lacrosse ball just above the knee, and I'm going to lie on my tummy. From here, with the ball just above the knee, I'm going to press my knee down into the ball, and I'm just going to start to contract and relax on top of the ball. I'm going to do about 10 of those before moving about an inch higher, and I'm just basically going to work all the way along, working up my rec fem as I go, all the way, hunting out areas that are juicy and a bit tight, just contracting, relaxing, and I'm going to come all the way into the top of the rec fem there and just contract, relax, work through there. Next, we're going to be working on the other side of the knee. Okay, so this area in here, I'm going to get on the lateral head of my quad. And again, I'm just going to contract, relax in that area. I'm just trying to restore function to the sliding surfaces, getting some added circulation in these areas, getting some new blood coming in with a view just to trying to work through inflammation. Now, you can work further up there. You might have to move your body around a little bit to find areas, do a little bit of rolling, and then contract, relax. So see how I've got my knee on the floor here, and I'm on my elbow as well. I can just about put enough pressure on that to be able to contract, relax on that lateral head. And then finally, big problem area is the TFL. So we're going to come into this triangular kind of tissue here, just at the top of the hip. So in here, basically, that can get tight. It's a hip stabilizer, amongst other things. And all I'm going to do here is just roll through that area. So I've got the lacrosse ball in my hip, and I'm just rolling through, hunting around for tension, just trying to relax, not trying to force anything. I'm just trying to relax on the ball, nice deep breathing as I go, working all the way through. And you can even start to come around then towards the back of the glute, on the back side of the IT band. Don't be on the IT band, just work the tissues that connect to it and work through there. Okay, so that's a really useful way of using the lacrosse ball. You can also then go on to use like a flossing band for the knees. Maybe get a foam roller in on the adductors as well, and also more lacrosse ball work in and around the glutes and piriformis. So hope you found that useful, and hope it helps.